What is vaginal discharge? Symptoms, causes, diagnosis, and treatment. Normal vaginal discharge is a healthy way for your body to get rid of fluid and old cells, but sometimes discharge can be a sign of something more serious. Signs and symptoms of vaginal discharge. Vaginal discharge is a normal occurrence that all women experience. It usually appears as a white or clear fluid on the underwear. Some women have discharge daily and others only on occasion. The discharge is made up of fluid and cells that shed through the vagina. The amount, color, and consistency of discharge may change based on the stage of your menstrual cycle, but discharge is different than menstrual blood. Cervical mucus. This is a clear liquid or gel-like fluid that is produced by the cervix. According to the University of North Carolina School of Medicine, discharge fluid can be several things, including cervical mucus. This is a clear liquid or gel-like fluid that is produced by the cervix as well as by changes during the course of a menstrual cycle or pregnancy. Arousal fluid. This is produced by glands in and around the vagina when sexual arousal occurs. The fluid lubricates the vagina, then dissipates usually within an hour of arousal. Seminal fluid. A man's sperm, along with other fluids. It can appear as vaginal discharge if you've had intercourse within the last day. Seminal fluid can stay in the vagina for hours after intercourse. According to the Merck Manual, when abnormal discharge is present, other symptoms may be as well, depending on what is causing the discharge. Other symptoms might include itching, burning, irritation, redness, pain during urination, and sexual intercourse. Causes of vaginal discharge. Normal vaginal discharge exists to keep vaginal tissues healthy, provide lubrication, and protect the vagina from infection and irritation. If vaginal discharge increases, it can be from normal menstrual cycle changes, per the U.S. Department of Health and Human Services, HHS. Pregnancy and the use of birth control pills can also affect the amount of discharge and how it looks. Per the Mayo Clinic, abnormal vaginal discharge that has an unusual odor, looks different than your normal discharge, or is accompanied by itching, irritation, burning, or pain may indicate that you have inflammation, an infection, or a sexually transmitted infection, STI, such as the following: bacterial vaginosis, cervicitis, pelvic inflammatory disease, PID, trichomoniasis, vaginitis, yeast infection, chlamydia, trachomatis, gonorrhea, vaginal atrophy, vaginal fistula, cervical cancer in elderly women who are bedbound or incontinent. Urine or stool may irritate the area around the genitals and anus, causing vaginal discharge, according to the Merck Manual. Some hygiene practices can cause vaginal discharge to be abnormal, including douching, using soaps or scented sprays, or forgetting to change a tampon. In rare cases, a woman may have an abnormal opening between the intestine and genital tract that results in an abnormal discharge from the vagina, also per the Merck Manual.